Why does hip AVN happen to you? Recently, a young 25-year-old patient came to us, diagnosed with stage 3 hip AVN on the MRI, suffering from hip pain for the last 6 7 months. And she never had any kind of substance abuse, had never had any injury to the hip, never had any other medical condition. And her first question was, why did it happen to her? Unfortunately, in India, every year more than 1 million patients are diagnosed with hip AVN. Most of them are diagnosed in the late stages because in the early stages, either the patient ignores hip pain or self medications with the painkillers, which further help progresses the disease towards the advanced stage, or receive the traditional treatments which do not help much with the hip AVN itself, although they bring down the pain a bit. So for Sudha also, she fell in the category of the 30% of the hip AVN patients for whom there is no reason. It just happens on its own. However, there is a significant chunk, nearly 35% of the hip AVN patients are the young people who have been using steroids for one or other reason. It can include steroids for the medical reasons and also for the bodybuilding purposes, which is quite common these days. And about 20% of the patients of hip AVN has a very strong history of abusing alcohol for a very long time. So simply speaking, if you have been diagnosed with hip AVN, it is not necessary or it's a high chance that you probably has not done anything wrong. But at the same time, if you are into activities which can result in high chances of hip AVN, like abusing the corticosteroids or having alcohol abuse issues, then you must be careful if you are getting the first symptoms of hip AVN, which are normally pain in the hip joint, stiffness in the hip joint, especially at rest also, and aggravated by movement or walking. And if it appears, you should first thing that you should do is get the right consult from a hip specialist to diagnose your condition properly and tell you the right stage of the hip AVN so that the correct treatment can be planned. And if you are in the early stages, appropriate measures can be taken to prevent the progression of the disease and avoid a hip replacement surgery, which will be needed in case if you are in the advanced stages of the hip AVN.